Hi, my name is Eleanor Tatum, and I'm the publisher and editor-in-chief of the New York Amsterdam News. The coronavirus crisis has brought serious distress to local economies and advertising along with them. The New York Amsterdam News has partnered with the Local Media Association during this unprecedented crisis. Help us continue our important work in chronicling the life of Black New Yorkers, and consider making a donation to the COVID-19 Local News Fund today. Go to givebutter.com/Amsterdam News. Again, that is givebutter.com/Amsterdam News. Thank you and stay safe.
It's Monday, May 18th, and welcome to the New York Amsterdam News Podcast. I'm Cyril Josh Barker. We continue our coverage of the COVID-19 outbreak with the third installment of our Monday's Mayor series with my guest, Rochester, New York Mayor Lovely Warren. She's going to be speaking with me about how COVID-19 is impacting her city. Well, Governor Cuomo recently announced the reopening of 6 regions in New York State that meet all 7 metrics required to begin Phase 1 of the state's regional phased reopening plan. This means that retail business owners are permitted to do curbside and in-store pickup, and residential and commercial construction can resume with guidelines. The city of Rochester is the 3rd largest city in the state and is one of the regions that reopened on May 15th. Rochester Mayor Lovely Warren says the city is doing well so far in Phase 1 and plans to continue progressing towards a complete reopening. And we welcome you to this episode of our podcast. And we're so happy to have Mayor Lovely Warren on this episode. She's doing some great things in Rochester, some great work up there. And I'm actually going to be asking her about something very innovative that she's doing that I learned about her when it comes to distributing PPE for her constituents. And we're going to be talking about that in our conversation. So be sure to watch out for that. I think it's absolutely amazing. The podcast, I have an announcement to make. Sorry, before that pause. The podcast is now on Apple Podcast. And so we're so happy to be there. We want to give a heartfelt welcome to our listeners on Apple Podcast. We're so happy to have you. If you have an Apple device like an iPhone or an iPad or an iMac or any Apple device, you can look for us in the Apple Podcast iOS app in the App Store and search for New York Amsterdam News. Well, I actually have a few stories that I do want to go over that we have on our website. First, recently, the fire on 125th Street near M. Clayton Powell Boulevard at the Lazarus Children's Clothing Store on Sunday. There were no injuries reported in that huge fire. It was a very big blaze. We actually have some photos and a video on our website. Also, 10 Black scholarship programs that are still open despite COVID-19. We actually get a lot of requests, people asking us about the various scholarships that are available. And so we have 10 of them on our website that you can check out for your students or your children. And then we also have in our entertainment section, we have 5 books by Black women that we're recommending that you read during this time of isolation and staying home and staying in. We think that these books are pretty awesome, and we hope that you check them out. You can find these stories and more on our website at amsterdamnews.com. Well, my guest today is Rochester Mayor Lovely Warren, who is on the phone with me to discuss how COVID-19 is impacting her city. Welcome to the podcast, Mayor Warren. How are you?
I'm good. How are you?
I'm doing fine. Thank you. Well, thank you so much for being on this episode of our podcast. This series is so important because we want to showcase the Black mayors here in New York State who are taking the lead in their towns, in their communities, with their citizens on combating COVID-19. First and foremost, just tell me what the situation is looking like in Rochester when it comes to COVID-19. What's going on?
So this past Friday, May 15th, we started opening Phase 1 of reopening, and we did not see the infection rate that other communities across the state had seen. So the governor and his team felt that it was time that we start to test reopening. When we look at our numbers, even though people have been infected, we have about 2,000 people, 2,100 confirmed cases. About 119 people are currently hospitalized. 22 people are in ICU. One of the things that we wanted to make sure and pay attention to was the rate based on race and ethnicity data. Mm-hmm. And we took a look at that. And even though our death rates are on par with our population and ethnicity population rates, we did see that people of color were being hospitalized or in ICU at larger numbers. And so we put together a campaign really to talk to Black and Hispanic community here called Protect Your Circle. And we believe that people have been listening. People have been social distancing and wearing a mask. And so we're hopeful and prayerful that our numbers will continue to remain consistent and that our curve has flattened and continue to deliver the message to our community.
Okay. That's interesting. I want to talk a little more about that Protect Your Circle. Tell me about that. Who thought of it? That's a wonderful name and a great way to encourage people to social distance. Can you tell me a little more about that?
So we thought of the city, me, my team, we thought of this in utilizing actual social media influencers here in our community, when across the country and a lot of the other major cities, you saw a disproportionate rate of African American and Latino people actually dying from the disease. We recognized that here there was this myth in the very beginning that Black people couldn't get the virus. And so we needed to change that perception. We need to let people know that it's very real and that it is actually and could have the potential to be deadly to people of color, especially those that have underlying conditions because of the already, disparities within the healthcare system. And so we asked for those numbers and we started to see that people of color were, in our community at least, were in the ICU at a much higher rate than other races. And so we decided to reach out to our community to engage with social media influencers and to really push out that this is about our circle, that we have an obligation to protect our circle, protect the people that you love, protect the people that you care about, and everybody has a role to play. And that role that you play is making sure that you're doing everything to protect yourself, and by protecting yourself, you're protecting your people.
Mm-hmm. That's a wonderful way to put it. And it just really kind of speaks volumes to, people enforcing social distancing amongst themselves as opposed to maybe law enforcement or somebody else. So what a great way to enforce that. It was announced by Governor Cuomo that parts of the state are going to reopening, and that includes Monroe County, where Rochester is. Tell us what that process is looking like. Are you ready to reopen, and are you confident that the city is ready to move forward with this?
Well, based on the numbers, I think that we are ready to try reopening. The governor and his leadership. So Rochester is the third largest city in the state of New York, located in between Buffalo and Syracuse. And so when they looked at the numbers in the Finger Lakes region in Monroe County, the governor looked at 7 key indicators, meaning, how many people are hospitalized, how many people are tested positive, do you have a steady, sort of decline in people that are going to the hospital, can your hospital handle an increase, and, where are are you ready as a community to listen to what the governor and his team is saying? And I think that we have, and I think that because we started social distancing really early on here, when we started seeing what happened in New York City, we shut down, we started doing things proactively that kept us in a place where we could, and our numbers look better. Now, I granted, one of the things that concerns me as the mayor is the fact that it has been really cold up here lately. So a lot of people have been inside, and as the weather warms up, I just want to make sure that our community still understands that even though we're in phase 1 of reopening, that the virus is still alive and well in our community, and we still have to do the things that the healthcare professionals have said that we need to do in order to protect our circle: social distancing, washing your hands, wearing a mask, not, going to different places and visiting without, the right protective equipment and other things like that. So I think that we need to start to see what the new normal looks like, and definitely believe that our community overall has been listening. We've had our challenges, of course, but overall have been listening, and we're going to try to see what phase one looks like and look at the numbers. And if the numbers are promising, then we will hopefully move into phase two.
Wonderful. And give us a rundown of what phase one is exactly. What's open, what's not open? What are some of the regulations that come with being a phase one situation for a city?
So phase one is really looking at the, so construction has reopened. Also, there are different businesses that have reopened starting on Friday. And those types of businesses are, hold on, I can get you the list. Construction, manufacturing, wholesale, trade, select retail, pickup for curbside only, agricultural, forestry, and fishing. So those activities or those fields that have, that you can social distance in, and that you can have, that has low impact on really that connection. So office space and all of that really hasn't opened up the way that in phase one, like City Hall is still closed to the public. We will open up hopefully in the future, depending on what the numbers look like.
Okay. Tell me a little bit about how this has impacted Rochester economically. Of course, the whole country right now, there are a lot of places in this country, people have lost jobs. There have been, cities have taken economic hits. And so I just want to kind of get an idea of what's happening in Rochester when it comes to the economy and how COVID-19 has impacted you all. So
the COVID-19 virus is a health crisis that has turned into a fiscal crisis for the city of Rochester and for municipalities across the country. We have seen we've lost about between what we anticipate in losing in AMA, which is 8 municipalities, and sales tax, probably about $40 million.
Oh, wow.
In just 8 weeks. When we look at the overall impact of the economy on our community as a whole, we have seen, businesses that are struggling, of course, to stay afloat. And we have tried to help them in many ways, thankful to the CARES Act and some of the dollars that they were able to give to businesses. We have done that. We've funded about 300 businesses with small grants to keep them afloat during this time. But, we can't get our revenue stream back. And that's where the biggest problem for many municipalities across the country. And thankful that the House of Representatives and, to Senator Schumer and Senator Gillibrand, that they're looking at how do we get relief to cities, because what Rochester is facing, every city across this country is facing, you can't really get back those revenue streams, sales tax revenue, as well as 8 municipalities and property taxes, the way that cities fund themselves. Right. And 2 of those revenue streams is severely hit by this impact. And we still have to provide police, fire, 911, also, DES, which is our Department of Environmental Services, all those essential services that our residents have come to appreciate and are used to. We still have to continue to provide that with the limited amount of resources that we have, and that's the struggle.
All right. I want to talk a little bit about education. A lot of cities have been, including New York City, they did the remote learning, the distance learning for the students. What has been going on with education during the COVID-19 pandemic in Rochester?
Well, you've been able to see the effects of the disparities, I should say, okay, in the education system. Very, it's alive and well. And the same disparities that you see in health, you see as it pertains to education. And I'll give you an example. My daughter goes to a private Christian school. When they decided that they were going to close schools, within 3 days, she was on Google Classroom. That Friday, their school sent home all their books. They sent home everything and said, we don't know what's going to happen on Monday. So here, take home everything and we'll figure it out. Saturday, Sunday, Monday, we were all getting emails. This is what it's like, and you're up and running. So my daughter, from one day after school's been shut down, has been on Google Classroom. She's been doing all of her work as it pertains to her math, her reading, gym, Chinese, all those things. And then I have the issues with we have the issues with some city schools where even today, kids fifth grade through kindergarten through fifth grade still don't have Chromebooks. They still have not been able to get them up and running as it pertains to getting their education right now. And so how are we going to pass a kindergartner to the first grade when we don't even know if they have the basics yet?
Mm-hmm.
So those types of, and even for our older students that it took weeks to get them up and running, to get them the Chromebooks, and they're not being held necessarily accountable because of the fact that, the school district has said, okay, we're not going to grade these papers. So it's basically optional if you actually even do the work. It has been stated that. So, there's many challenges that come down with the educational system and what's going on right now. And I'm just hopeful that our children don't suffer because of the fact that adults can't get it right for them.
Right.
We had a superintendent that just in the middle of his first year decided, because of the situation that he was facing with the school board, decided to quit, go to another job. Where the CFO from our school district just decided that he was leaving, and there's more to come. And so in the midst of this virus, we have a situation where our most challenged students in our in a district that has a lot of challenges and issues, and there are bright spots, of course, but overall, the effects of the miseducation of children is real. And, I see, my friends that have kids in charter schools, they have been able to adjust very, very well to the changes, but we just need to make sure that children don't suffer in this process. And I feel that their education across the board is suffering depending on what school you go to, and rather your school is able to provide the resources and the opportunity for you.
Okay. One of the things I definitely wanted to talk to you about, which I thought was absolutely amazing, is that you actually mailed face masks to your residents. And I don't know. Haven't heard anybody else doing that. I know we didn't get that here in New York City. They're being handed out, but you mailed them, and that's amazing. Tell me how that worked and how that came about. That's amazing.
Yes. So yes, we did mail masks, and the reason why we mailed masks is for several reasons. I must thank the county executive here was able to secure, millions of masks for our community, and he gave them out to municipalities to distribute the way that they see fit. Some people did distributions where people just drove up and they were able to get masks. But for us in the city of Rochester, you have transportation. Many people have transportation challenges. I have a population that's elderly. I have a population that's disabled. I have population that have some immune deficiencies. And we wanted to make sure that everyone had equal access to opportunity, right? So if I didn't have a car, then I couldn't, in a distribution site, I couldn't drive up on my bike or ride up on my bike and get a mask. That's not how it worked. So we felt that it was best to make sure that everyone gets a mask. We mailed 5 masks to every residential home within the city of Rochester. And it was worth it, because I feel like if we're going to tell people that they have to wear masks out in public, then we need to make sure that everybody has access to masks out in public, access to masks. And the best way for us to ensure that was for us to mail it to them.
Right.
And they started meeting last weekend, earlier this week.
Okay. Again, that's amazing. I have not heard any other municipality doing that. If there is, I certainly don't know about them. So that just blows me away. What is testing looking like in Rochester? Because this is an issue that is kind of at the heart of bringing everything back to normal, getting things back to where they should be. What does testing looking like what does testing look like in Rochester, I should say?
So testing here, we have been in the very beginning, more people are getting tested now than, of course, in the past, because tests were reserved for those people that were having symptoms and other things. And so we have more testing sites that are open up. There are a few sites that are doing, walk-in testing. All of our first responders have access to be tested now. And so it has evolved over time. And because of that, we will start to see, I think that you'll see numbers start to go up, because more people are going to have access to the testing. Right now, anyone that wants to be tested can't just walk up and be tested. And some sites like Trillium and Jordan Health Center, they're doing that, but not across the board. There was, in the very beginning, this, you had to meet a certain criteria, your doctor had to order it and things like that, but it's evolved and it's gotten better over time. And right now we also have, the governor issued an executive order that people that are working in nursing homes, that they have to be tested twice a week, I believe. And so, for us overall, I think that testing has improved and access to testing has improved for us. And we're thankful, because we want to make sure that people, and that has been one of the major concerns, that people were told, stay home. And, if you feel this way, don't go to the emergency room, basically social distance for 14 days. And that's what a lot of people did. And, but we also had a lot of people that wanted to be tested and could not be tested. And I don't think that that's really a problem nowadays, because some of the sites are doing walk-in testing.
All right. And last thing I do want to ask you about is that the city council actually received an A rating from the New York Council for Open Government for public access during the COVID-19 pandemic, which I think is amazing. How are you getting information to your citizens? And I'm asking this to a lot of mayors, because, here in New York City, we get to see the mayor every single day on live television. He does a meeting, but every mayor doesn't have that same capacity. How are you getting information out to your constituents?
So every method that we have, of course, the social media methods, whether it's Instagram or Facebook, Facebook Live, Zoom meetings. We've done telephone town halls. We've done conference call meetings. We have we've done media availability with our news stations, and so we try to just push out as much information as we can. In the mailing that we did with the mask, we also talked about the census, which is very important. Okay. That's happening right now. And we, for every person that doesn't fill out the census form, it's $26,000. It costs the municipality $26,000 in federal funding. And I think that that's very important for people to understand, especially now during this pandemic, that the resources that we may receive through ESG, through CDBG, through other mechanisms from the federal government, it's all determined, resources that people receive for food and for WIC and other things is dependent upon them filling out the census. So as it pertains to getting out information, we use every method that we have available, from mailing to also radio, in social media and utilizing traditional media streams, because I think it's very, very important that we don't do things in a vacuum, that my constituents hear from us directly about what's going on. And we have been very forthright in trying to give them the information as we have readily available. And as things change, we try to come out in front of it to say, this is what's happening as we start to reopen. Understand that we're not opening fully, we're opening up in phases, and what we do today can affect tomorrow and can actually, stop things and slow things down. So we just really want to make sure that we get information to people in the way that they can receive it. And if that's through the radio, if that's through telephone, if that's through television or social media, we're on every network trying to get that information to them.
All right. Well, Mayor Warren, thank you so much for being on the podcast today. What you're doing in Rochester is absolutely amazing. And good luck with phase one. And, we definitely want to speak to you again as things move forward.
Thank you so very, very much for having me. And I just want to tell our entire, our state and the Amsterdam News, thank you for having us. Thank you for covering this very, very important issue and all the issues that you cover. It's very important that the community gets a voice and an understanding of what's happening, and that we continue to lift each other up and work together to make the change that we want to see happen in our communities.
All right. Thank you again so much.
All right. Take care.
That concludes this week's podcast. You can pick up the latest edition of the New York Amsterdam News on newsstands and get updates online at amsterdamnews.com. You can also keep up with us on Facebook at NY Amsterdam News and follow us on Twitter at NYAmNews. I'm Cyril Josh Barker. Thanks for listening.
Hi, my name is Eleanor Tatum, and I'm the publisher and editor-in-chief of the New York Amsterdam News. The coronavirus crisis has brought serious distress to local economies and advertising along with them. The New York Amsterdam News has partnered with the Local Media Association during this unprecedented crisis. Help us continue our important work in chronicling the life of Black New Yorkers, and consider making a donation to the COVID-19 Local News Fund today. Go to givebutter.com/Amsterdam News. Again, that is GIVEBUTTER.com/Amsterdam News. Thank you and stay safe.